Let me try to address that.
One other thing. Why, if the president goes on there and says, American citizens, the congressmen do the same thing, the senators do the same thing. This is a public option. Fine. But in reality, we, the older people, are going to be sacrificed by allowing non-resident illegal aliens. Medicare to pay for these people. This is going to ration my care. And I don't think this is right. I've worked in this country since I can remember. I retired here. I live here. Yet these people are getting an option they don't have to pay for. And including they don't have to pay taxes. What the hell is this all about?
Amen.
Let me try to address those issues. First of all, you went fast. You have a specific health care insurance company?
Yes.
Okay. Blue Cross?
No, I'm not
TRICARE. Okay. Well, TRICARE is a veterans care. Thank you for your service to our country. Well, let's say you had a normal private option like Blue Cross. In this plan, creating an exchange where you could go and get the same options federal employees have. You could still buy your Blue Cross plan, and you wouldn't have to go to the exchange at all. So you have, this whole setup is about voluntary choices. So that, well, let me finish. You would have the choice of sticking with the plan you have. If you liked it, it'd be absolutely there. Or you would have the choice of going to the exchange and buying a competitor's plan, or buying the same plan, perhaps at a cheaper price. But there is no, and I want to emphasize this because I understand that the contrary has been represented in many forums in this country. There is no mandate of any kind that you would have to choose any particular plan. Not that you'd have to go to Blue Cross, not that you'd have to use the public option if it existed, not that you'd have to go to Providence or Kaiser. You get to choose. You get to choose if you keep your own plan. You get to choose if you want to go to the exchange to get additional options that companies have decided to offer. So, ma'am, I'm going to ask you to wait your turn so that I can keep answering this gentleman's questions. The second was, is there some kind of commission you have to go to get approval for what health care you're going to have? The answer is no, there is not. Just as you have Blue Cross now, you have Blue Cross then. And just as you have to get your insurance company to approve your treatment now, you have to try to get it to approve then. Insurance companies sit there every day and look at claims and say, no, we're not going to cover this, we are going to cover this, based on the rules that they establish in their contract. And sometimes you have to fight to say, yes, you are supposed to cover cancer treatments. Yes, you are supposed to cover diabetes. They say, well, no, we're not. I say, yes, you do. You have to pull out your insurance policy and push your case. Exactly the same way. There's no government commission set up to decide what and how treatment you would receive. The third issue on immigration, every plan that has come out on the House side or the Senate side is emphatic about these options. By options here, I mean the full range of Blue Cross, Blue Shield, Kaiser. The participation in the exchange is for legal residents of this nation. And there would be the same, there would be a verification process of some form to make that happen. So just so you know that's how those three pieces work.